hang on a second, I'm just going to check it's recording. Yeah. Okay, so we're ready to go. Oh. Okay, Suzanne, so I'll control the slides, but I'll just let you present.
Brilliant. All right. Well, it's lovely to sort of see some of you. I recognise a lot of familiar faces. So we're just going to go through a little bit of general information about COVID-19 to start with, then move on to more specific information for people with ataxia. So if we can just start on the first slide. So first of all, what is coronavirus or COVID-19? So it's obviously a new illness that can affect your lungs and airways, caused by a virus called coronavirus. It's thought to be natural and have an animal origin through spillover infection. We do know that it's spread via respiratory droplets from touching contaminated surfaces and then touching one's face, so very specifically touching your eyes, your nose or your mouth. The time from exposure to onset of symptoms is between 2 to 14 days with an average time of about 5 days. So currently there's no specific treatment for coronavirus, so management is really just aiming to relieve the symptoms while your body hopefully fights the illness. So for the majority of people, this results in very mild symptoms. Some people, they're not even aware they're unwell with the virus. Unfortunately, some people do progress to have severe pneumonia and multi-organ failure. So the symptoms of COVID-19, it predominantly affects the lungs and airways. Normally it will start off with a fever and a dry cough, which can lead to shortness of breath. So the things that you need to be particularly alert for are a high temperature, so that's over 37.8 degrees. A new continuous cough, so this means coughing repeatedly for a long period. So the NHS is sort of suggesting if you're coughing repeatedly for an hour, or if you're having several repeated sort of coughing episodes over 3 hours, that's what they would classify as a continuous cough. If you or someone you live with experiences these symptoms, then you should really be following the NHS guidance on how long you should be staying at home and self-isolating. So I think we've probably all heard a lot of that information in the media over the last 3 or 4 weeks. And so the dominant message is to stay at home for everyone, whether you're unwell or not. But very specifically, if you have those symptoms, you should be stringently staying at home and isolating. Moving on to the next slide. So how long to stay at home? If you have the symptoms, you'll need to self-isolate for a minimum of 7 days. After those 7 days, if you don't have a high temperature, you don't need to continue to self-isolate. If you still have a high temperature, you need to keep self-isolating beyond the 7 days until your temperature returns to normal. So as our Prime Minister very helpfully gave a good example of that, after 10 days he still had a high temperature, so he needed to continue self-isolating, and obviously then proceeded to become quite unwell afterwards. You don't need to self-isolate if you just have a cough after the 7 days. So as with any sort of viral infection, a cough can last for several weeks, up to 8 weeks following the infection, so you don't need to continue isolating until your cough is completely gone. Now, if you live with someone who has symptoms, then you'll need to all stay at home for 14 days from the day the first person in the home started having symptoms. And obviously, if somebody else becomes well in the middle of that 14-day isolation period, then you need to carry on 14 days beyond that as well. And on to the next slide, please, Emily. If you live with someone who is particularly vulnerable, so that's somebody who's over 70 or has a long-term condition or is pregnant or has a weakened immune system, then ideally, obviously this is quite difficult at the moment, you would try to find somewhere else for them to stay for 14 days. If you do have to stay at home together, which is more than likely in the current climate, you have to just try as much as possible to keep away from each other during that time. So the advice from NHS is that if you cannot cope with your symptoms at home and your condition gets worse, or your symptoms do not get better after the 7 days, then you need to use the NHS 111 online coronavirus service. If you don't have internet access, then you can call the NHS 111 And as ever in a medical emergency, you should call 999. So for the healthy population, they're saying you don't need to contact 111 to let them know that you have symptoms and you're staying at home. I think for people with ataxia who are vulnerable, so the extremely vulnerable category, which we'll move on to shortly, the advice is that you would identify yourself as having symptoms as soon as you get them. Don't wait for them to get worse and to be unmanageable before contacting 111. So I think that's a really important distinction. But that should be in the advice that the government is giving people who are extremely vulnerable or being shielded, which we'll move on to shortly. So on to the next slide. How will COVID-19 affect people with ataxia? Obviously, this is a new virus, so we don't understand everything about it yet, and we don't have a lot of information about how it will affect people with ataxia. But we do know that people with ataxia do experience a temporary worsening in their ataxia symptoms, so things like balance, coordination, vision and speech when they're suffering from any infection. So many of you may have noticed that if you become unwell with a bladder infection, you will notice your balance is a little bit worse. So we would expect that if a patient with ataxia develops symptoms from COVID-19, that their symptoms of ataxia may get worse while the flu-like symptoms or pneumonia persist. But I think the key bit is that this would be a temporary worsening. We wouldn't expect this to be something that would continue beyond the infection.
Suzanne, sorry to interrupt. I don't know if maybe you could try standing further back. Your voice is a little muffled.
Right.
So it's probably the connection, but...
Sure, I think it's saying unstable internet, so I think there's a lot of internet problems this morning.
Okay, thank you.
Sorry, is that a little bit better?
Possibly.
Let me know if that's better. So the thing that everybody wants to know is, are people with ataxia more at risk of catching COVID-19? The reassuring thing is that for the majority of people with ataxia, you have the same risk of developing COVID-19 as anyone else. There's a very small group of people who have autoimmune ataxia and are specifically receiving immune suppressant medication who are at risk, but for the majority of people, there is no additional risk of developing COVID-19. So the majority of people with ataxia should be following the government's general advice on staying at home and following the social distancing advice that everyone should be following. So what is social distancing and what does it mean for people affected by ataxia? So as I've just said, this is something everyone should be following at the moment. Only leaving the house for very limited purposes, to go to work if your work is essential and can't be done from home, to get food, to get medicines, and to go outdoors to exercise once a day. If you do leave the house, obviously that advice to stay at least 2 meters away from other people and washing your hands very carefully when you return home is important. And are there any extra precautions that should be taken for people with ataxia? So we would say that because it is a neurological condition, we would classify everyone with ataxia as being within the vulnerable group, not because they're more at risk of getting COVID-19, but if they do, they're more at risk of complications because they have an underlying health problem. So that goes for anyone with any sort of long-term condition, the government is classifying you as vulnerable. So at the moment, people who are classified as vulnerable aren't being asked to do anything different to the rest of the population. We're all meant to be staying at home. The advice would just be to be particularly stringent in following that social distancing advice. So you may well feel that you want to take extra precautions to avoid contact with other people for the time being. So avoiding going out to the supermarket, those sorts of things, if there's someone else to do those things for you. Obviously, the advice is constantly changing, and at the moment, the advice for vulnerable people is the same as the rest of the population. Down the line, as restrictions hopefully get lifted, that advice might become different. So I think it's important to keep looking at the government information for people with vulnerable people. That link will be on the slides, which I think should be available at the end of the session. But at the moment, the majority of people with ataxia, the advice is to follow the advice to stay at home that the rest of the population is being asked to do. So something that's causing a lot of grief is these letters that have been sent out by the NHS advising certain people in the population to shield. So these letters are being sent out to people who the NHS has identified as being extremely vulnerable and at very high risk of severe illness from COVID-19. So these people are being advised to shield, and this means staying at home at all times and avoiding all face-to-face contact for at least 12 weeks from the day you receive the letter. The exception to this is obviously if you have contact with carers and healthcare workers, that should obviously still continue. So at the moment, there's not a lot of difference to what the rest of the population is being asked to do. You should really avoid leaving the house at all, so even for staying at home. So the vulnerable people that the government has advised, and you've probably seen in the media and on the PHE website. It's a very specific group of people that you may notice ataxia isn't specifically mentioned. So they're advising that people who are solid organ transplant recipients, some people with cancer who are still undergoing treatments which will affect their immune system, people on immune suppressing drugs, women who are pregnant and have any form of heart disease, people with severe respiratory conditions, so severe asthma, COPD, cystic fibrosis, and some people with rare diseases that affect their immune systems. So further to this, the Association of British Neurologists have reviewed this list and are recommending that people with neurological conditions plus additional health problems should be included on this list. And so they've been asked to review all of their patients and establish which people should fall into this extremely vulnerable category. So on the next slide, I'm just going to go through that list with you. So extremely vulnerable people with ataxia would include people who are over 70 years of age with ataxia, ataxia with any additional comorbidities. So that means if you have ataxia and diabetes, any sort of cardiac complications such as cardiomyopathy, but not just limited to that, or any sort of respiratory complications. Ataxia with significantly reduced mobility. So for example, if you're wheelchair bound or living in a care home and you are significantly reduced in your mobility. Ataxia with significant difficulties in swallowing. So for example, if you require assistance with your feeding, with a pig or a wig. Ataxia taking immune suppressants for comorbidities or for autoimmune ataxia, as I mentioned previously. And finally, ataxia with pregnancy plus any sort of underlying cardiac complications we classify as extremely vulnerable. So pregnancy and COVID-19, that's something that we've had a lot of patients ask about. So pregnancy in a very small proportion of women can alter how your body handles severe viral infections. And for this reason, pregnant women have been placed in the vulnerable category. So this is something that midwives and obstetricians have known for many years and are used to dealing with. As yet, there's no clear evidence that pregnant women who get this infection are more at risk of serious complications than any other healthy individuals. Obviously, we've just mentioned people who have ataxia and pregnancy and cardiac complications are considered to be in the extremely vulnerable category and are advised to shield for 12 weeks. So I would just recommend keeping an eye on the PHE advice again on that website, guidance on social distancing for all vulnerable people, including pregnant women. What should I do if I receive one of these letters from the NHS? You're strongly advised to follow the government's guidance on shielding and protecting extremely vulnerable people. All people who have been told to shield should register on the government website. That will be on the letter that you should have received. But the link is also available on the Ataxia UK website. And you need to let them know whether or not you need support. So part of that registration process, there are options for you to say whether you need help with groceries, whether somebody's able to bring groceries in from the front door, etc. So this will help you to access support with food and medication deliveries. Even if you don't need any support with daily tasks, it's still important to register on that website just to let the government know. So even if you're completely fine, you've got somebody to support you at home, it's still important for you to register on that website, just so that I imagine you can be contacted with updates on the advice in terms of social distancing as things change. So what should I do if I haven't received a letter when I think I should have? So the NHS has sent out letters to the majority of people who should be shielding. However, as can be expected, this is an enormous task. There are likely to be people who have been missed off this list. So just to reassure you, GPs and specialists, including our service, we've been asked to review our patient records to identify anyone who we consider to be extremely vulnerable who hasn't been sent a letter. So this is a bit of an ongoing process, just because of the sheer volume of people and information that we're trying to wade through at the moment. So it's important for you to contact the GP if you think you fall into this category and haven't received the letter. But it's important to note that you can still register on the government site for additional support even if you haven't received the letter. So anyone can go onto that website if you think you fall into one of those categories to register for that support. And I think there's a comment on the Ataxia UK website already, just sort of saying when you go through that process, you need to click yes on the page if you have a medical condition that makes you extremely vulnerable to coronavirus. If you click no, it will say that you're ineligible and you cannot continue with that registration process. So even though ataxia won't specifically be listed as one of the conditions, you still need to say yes, because I do have a medical condition that makes you extremely vulnerable. Should I shield if I haven't received the letter? So this is quite a personal decision. Some people feel more comfortable because they're feeling extremely anxious about what is happening around them to choose to self-isolate, and that is perfectly fine. It's obviously not something everyone will want to do because it is extremely limiting to not be able to leave your house at all for 12 weeks. If you haven't been advised to shield by a health professional, you obviously won't be eligible for the government support, so getting food and medicine delivery via that registration website I've just spoken about. So if this makes it difficult for you to shield, then you just need to try and follow social distancing guidance as closely as you can. Alternatively, there are a lot of organisations that have sprung up in this crisis to help you with support in getting groceries and medicine, etc. So even if you don't get the official government support, there are lots of organisations, which I think Emily is going to discuss at the end of these slides. One of them being COVID Mutual Aid, which is a website where you can just enter your address details and it will then come up with the options available in your area. If you want to have a little bit of a read about what shielding involves, then the website link to the government advice on this will be included on these slides, which will be available at the end. So I live with someone with ataxia. What should I do? So a lot of people are quite anxious about how they can support their loved ones at home during this time. So obviously maintaining good hygiene as much as possible at home, washing your hands often for at least 20 seconds or using a hand sanitizer, making sure you're being just extremely careful with washing your hands after you've coughed, covering your mouth and nose with a tissue when you sneeze, etc. And general interventions like cleaning a little bit more frequently and making sure the property is well ventilated, opening windows, etc., where it's appropriate. In terms of, onto the next slide, in terms of whether or not to wear a mask, currently the PHE guidance is that in the healthy community, the evidence is currently not compelling that wearing a mask is at all helpful. So it's quite important to distinguish between healthy and people who are symptomatic with COVID. So in the general community, if you're well, if you at home are well, your family members are well, there's no need for you to be wearing a mask at the moment, and that's the PHE guidance and the WHO guidance, which was reviewed on the 6th of the 9th of April. if somebody is symptomatic with COVID-19, obviously that's a different scenario. At that point, somebody within your home needs to obviously try to isolate from other members in the property as much as possible. If you are in the same room as that person, then the person caring for a person with COVID-19 and the person who is unwell, both should be wearing medical grade masks. But if everybody is healthy and fine, the current advice is to not be wearing a mask. But I say current because obviously information is constantly changing, and the government has sort of intimated in the last few days that they are reviewing the evidence as it stands. So currently today, they are still continuing to say that there's no benefit in wearing masks for the general population. I think there's also clearly some concern that we want to reserve medical grade masks for people who need it at that important time when they are unwell. Finally, the person who's caring for somebody with ataxia at home, I think it would be helpful to have a list of things ready to take to hospital in case that's needed. So I think a statement saying that you have ataxia, obviously these are all very rare conditions, and this is the time when you want people to be immediately clear on what your health problems are. So I would suggest taking a copy of your latest clinic letter, or even just taking a photograph on your phone and having that on you at all times is not a bad idea anyway. Any additional care needs that you require, so just information about what mobility support you need and assistance with personal care, just to give people in the hospital an idea of what your normal function is. A list of any medications that you're taking, including dosing frequency, details for your neurologist and other specialists involved in your care. It's important for hospitals to be able to liaise with the people who know you well if you become significantly unwell with COVID-19. And finally, if you have an advanced care plan, then it's important to take that with you. And finally, COVID-19 and mental well-being. Obviously, this is a really stressful time for everyone. Most of us are very worried about the impact this is having on our families, our jobs, and being asked to stay at home is a really difficult thing. And regardless of whether you have ataxia or you're part of a healthy population, this is a really difficult, stressful time. So I think it's helpful just to know some of the resources that are out there to help you cope. So Mind, the charity, has some very good suggestions on their website in ways to connect with other people, planning how you're going to spend your time, ways to stay relaxed and to be creative at home. The NHS similarly has some tips as well. It's also important to be obviously mindful of your physical well-being with COVID-19. So for people with ataxia, this is especially important. As health professionals, we are always going on about keeping active and physically active as much as possible. So this is a tricky time for people with ataxia who, particularly if you're shielding and staying at home for the next 12 weeks. It's still very, very important to try to remain as active as possible within the restraints of social distancing. So I think it's really important, if you've got a home exercise program already provided by a physiotherapist, to try to continue to perform these exercises daily. If you're not shielding, to try and go out for a walk every day. I think there's a lot of things available on the internet now to stay active, with exercises that you can do within a small space at home. So I think just having a look at what's out there. I've put a couple of links to some NHS Pilates-based exercises that you can do at home. The first one is for people who do have kind of a reasonable amount of mobility, that you can do some floor-based Pilates, or if you can't get down onto the floor, some exercises that you can do on bed. And there also, there's a second link to Pilates-based exercises that you can do sitting in a chair. So for people who are wheelchair bound, still continue to do some exercises that particularly focus on core stability and balance. And finally, I think just to be aware of the websites where you can keep up to date. So those links will be on the slides as well at the end of the webinar, in the different areas where these might differ in England, Scotland, Wales and Northern Ireland. Obviously, information is just changing constantly. It's really important to keep looking on those websites just to make sure things haven't changed since we last looked. I think that's the end of my slides. I think Emily might have some more to add on to the end.
Yeah, thank you, Suzanne. That was really, really informative and so helpful. I feel like people will find that really useful. So thank you for taking the time to do that. I just wanted to say one thing from Ataxia UK, and that's just about finding local support that Suzanne also touched on. So whatever your situation is, whether you're in the extremely vulnerable category and are shielding or not, if you feel that you need some practical help, for example, food shopping or getting medication, you can find local voluntary services. So these groups have been popping up all over, and these two websites I've put here allow you to search by your postcode to find local volunteers that could help with things like that. And on the Ataxia UK website, we now have a COVID-19 section that's highlighted in red here. It's just on the normal main bar on the website. If you go there, you'll find all our latest information, including how to find these local volunteers. And if you need any help with that, you can contact the helpline in the usual way. It's open Monday to Thursday, 10:30 to 2:30, or you can email us at help@ataxia.org.uk. So that's it for the presentation. So I'll stop sharing the slides now so everyone's back. So we'll have a look at some questions that we had beforehand, which I think Paola might now be on the call as well as Suzanne. So between Suzanne and Paola, maybe they can answer these questions. So some of them we managed to cover in the slides, I think, but we've got some more kind of specific questions. So we mention as an additional condition alongside ataxia, cardiomyopathy, which is a heart condition. But what about if people have other heart conditions that aren't specifically mentioned alongside ataxia? Should they be socially isolating? Should they be shielding? What kind of group would they fall into?
So the ABN guidance really is any sort of cardiac complication, so even beyond cardiomyopathy. If there are other cardiac complications, then we would say that is an additional comorbidity which is significant enough to put you at additional risk. So we would say you should be in the extremely vulnerable category in that case.
Okay, so I think we have cardiomyopathy as an example on our website, but Suzanne's
Exactly,
saying other cardiac complications as well would also put you in that group. So you touched a little bit on exercise, which is really useful, and I think those NHS links will be good to have a look at those. But have you got any tips for staying motivated to do exercises when you're in the house and you don't want to do that, especially for children? Have you got any ideas there?
Well, I think there is so much that has sprung up in the last 6 to 8 weeks of, I think, pretty much every personal trainer, Pilates instructor. I've seen karate instructors even doing sort of Zoom classes, and obviously it goes beyond a lot of people's comfort zones to be doing things like that. But I think actually having live interaction with somebody else at the moment, there's a bit of a psychological benefit to that as well as the physical. So I think really just exploring ways that you can creatively still exercise at home is really important. In terms of what children can do, I think there are loads of children's sorts of exercises available online. I think one a lot of the schools use is called Go Noodle, and they kind of vary in difficulty. So obviously for some children who are affected with ataxia, some of those things might be needing a little bit of adaptation, but I think the key is to try and find something that you can do at home that you enjoy, but to sort of think outside the box. I think at the moment, there are a surprising amount of things that you wouldn't traditionally think you would be able to do online. There is an awful lot out there now. So really just having a look on the internet, if perhaps even just arranging a Zoom or Skype chat with your children's friends to sort of do something together. I think it's just about being creative with using technology to try and do that.
Yeah, thank you. And so we've had a question here about keeping up with exercise again. So do you think if you don't manage to keep up with the exercise, this could impact your progression? Do you think that could have an impact?
I mean, hopefully this isn't going to be something that goes on for a long, long time. Obviously, we know that people with ataxia, if they become unwell and can't exercise for a period of time, as with all of us, there is sort of a period of deconditioning where you might find your balance is a little bit worse, or your coordination might be a little bit worse. But we wouldn't expect that this would affect your overall progression. It might be there is a bit of a dip in your symptoms where they're worse when you're not physically as active, but it shouldn't actually affect your progression. That it doesn't affect your progression, it's just more, you will become deconditioned, as we all will, the entire healthy population. If we all stay at home for the next 12 weeks and don't do any exercise, we'll all get a bit weaker. But that doesn't necessarily mean your condition is progressing. It just means those symptoms are a bit more prominent because you aren't maintaining your normal activity, which keeps things at a certain level.
Sorry to interrupt with another technical issue, but I think Paola Giunti is trying to talk, but she's been muted. I don't know, Emily, if there's something you can do at your end so she can join as well.
That may have been her. Paola, can
Hi, everyone.
Yeah. Hi, Paola.
Yeah. Hello, how are you? One comment that I wanted to make about motivation and how you can carry on to be self-motivated. One thing is very important in the confined environment is a routine. So you structure your day and you try to plan ahead. As Suzanne quite rightly was saying, you know, using the IT tools, so the Zoom, for example, and to have sessions for the children with the other friends. But even if you don't have internet, to plan activities for them, they are pleasurable, and obviously the child will like to do that activities like painting or Play-Doh, or you know, play or do some reading together. You know, that kind of structure. If you have your day structured in this way, then you know that, you know, the slot for the physical exercise will come, and it makes it easier, obviously, to do things in that way. So maintain yourself, you know, have a little bit of self-discipline, and trying to, for example, wake up at the same time and go ahead throughout the day with some activities. So you know that, you know, at that time, this appointment would come, for example, with, you know, a session will come with a painting or physical activities or playing cards or so forth.
Thank you, Paola. So the next question, I don't know who wants to answer this one, but what effect has coronavirus had on ataxia research and clinical trials that were ongoing?
So unfortunately, the coronavirus has put on hold all the other research, and the laboratory has been used and dedicated and focused on coronavirus, for example, tests and treatment trials. So at the moment, I'm afraid the other research are put on hold. We hope that, you know, this is going to end very soon, perhaps in end of May, we hope. But obviously we are listening to the government rules, so we need to obey and being very, very careful about what we are doing, and only through the government rules we could lift up the lockdown.
Yeah, thanks, Paola. So we've also been getting in touch with any Ataxia UK funded researchers, and obviously it's the case everywhere that the labs are closed, and people are trying to, if possible, do data analysis at home or to write papers and things like that. So hopefully anything that can be done away from the lab is still being worked on, if possible, from home. And
yeah.
yeah.
So we try to do some, the activities that we can do. For example, meetings are still happening because we use, these tools, for example, this platform, Zoom, to connect and to plan ahead. But the real laboratory work, obviously, has been put on hold in every country.
Yeah. And kind of in a similar theme, and what's happening with the London Ataxia Centre? What should people with appointments coming up expect? Maybe.
So for the clinical appointment, you mean?
Yeah.
So the clinical appointment, we have migrated all the face-to-face clinical appointment to the telephone appointment. And we are working very hard to try to resume as well our MDT clinic for the multidisciplinary clinic that we had with physiotherapy, speech and language therapists, and occupational therapists, and myself, to have a teleconference. So, possibly using Meet or using Zoom. We don't know still what we can use, but we try hard to do as well a telephone clinic with the videos.
Okay.
This is at the moment our project. So we're having meetings with the trust to understand how better we can implement the teleconference for the clinic as well, because it does make a difference.
So could I just add?
It's still going on. So we never stop any activity. We just swap from the face-to-face to the telephone clinic. So the people can still email us and discussing with us. Suzanne has telephone clinics. She had telephone clinics even before the lockdown. So we use these tools more now regularly.
Yeah. Did you want to add something, Julie?
So I was just saying, so if anybody has had an appointment and they haven't heard yet, will you be writing to everybody to say that there's going to be a change to a telephone appointment? So they just need to wait for you to get in touch. Is that protocol?
I guess that this is already happening.
Mm-hmm.
So they should be.
Usually patients receiving letters a few weeks before. Suzanne, would you like to comment?
So I think the hospital is also sending out a text message prior to the appointment just to reiterate to not attend. So all outpatients face-to-face appointments at the moment have been cancelled. So patients should be receiving that text reminder, but as Paola's just said, that the letters going out sort of for appointments in the next month or whatever, they should have on the letter that it will be a telephone or remote appointment. But we will be contacting anyone with appointments in the meantime that have been converted to telephone. I think that the take-home messages don't come to the hospital at the moment. Assume that your appointment will be done via telephone or hopefully video clinics very soon.
Yeah. So you'll let people know a few weeks in advance. So if somebody has an appointment, say in June, they probably won't have heard from you yet, because it's sort of something that's ongoing. Thank you.
Exactly.
Yeah.
No, certainly not. June is quite far. Yeah. There will be much more near the day where they had an appointment stated in the previous letter.
Okay.
So I would like to make a comment about the letter Suzanne mentioned before. So for people that are at high risk, So if you feel anxious about, you haven't received any letter from the government, and the GP doesn't know in which category you're falling, please get in contact with us, because we can produce a letter. What we did straight away, immediately when the category came about, Suzanne went through all our patients, and we classified them. So the high risk then list the patients who we thought were high risk. This list has been compiled and sent to the head, so the clinical director, and the clinical director then to the trust. And so we're thinking that then there was the compiling list of every specialty, and then the aim was to send it to the government. However, things can happen, and so mistakes can happen. So if you are in the situation in which you do not have a clear idea where you should place yourself, vulnerable or high risk, highly vulnerable, please contact us.
Okay.
And obviously, if you are not our patient, please contact your clinician, your neurologist.
Yep, so if you're a patient at the London Ataxia Centre, you can contact the centre. If not, contact your neurologist about this. Yep.
Yeah.
Okay, great. So we just have a couple more questions that were submitted beforehand to cover. So one of these was, are people in the vulnerable group less likely to receive a ventilator if needed? So Suzanne, I don't know if you have an answer to that one.
So I think the answer to that is that the clinical judgment doesn't change in this scenario. So if somebody with ataxia presents at A&E and they are in the extremely vulnerable category, they will be assessed like anyone else in terms of their clinical need. So being categorised doesn't have any impact on the sort of care you'll receive. It's more to do with the advice that you're being given beforehand on how to protect yourself in terms of shielding. So when you present at A&E, you will be assessed as anyone else in the population as to what level of support you will need. So there should be no change to that. People will still make the same clinical decisions that they always have. I don't know if Paola has anything further to add to that.
Yeah, so in a nutshell, if you are classified in one way or another way, vulnerable or high risk, highly vulnerable, you will not change your management whatsoever.
Okay,
so it will depend pretty much on you'll stay there and then the decision will be taken for being on the ventilator or not.
Right, so I don't know if Suzanne, your signal broke up a little bit there, so I'll just repeat the answer for what I think the answer was for anyone that didn't hear that. So it won't have an impact on your treatment, whatever group you fall into. It will not impact on the treatment. It's more to do with the advice that's been given now. Is that right?
Yeah.
Okay, good.
Yes.
Okay. And the last one that I've got that was submitted beforehand is that someone was told previously that they could go out in their wheelchair for a walk, but then received a letter to say they're extremely vulnerable. So what would your advice be there? What advice should they follow?
So obviously the advice is there for your protection. So I think you need to be sensible that if you're going out of your house means you're going to immediately be in a crowded area where you're going to come into contact with people, then no, you shouldn't leave the house. I think it's about avoiding face-to-face contact. So it's advice, it's not something you absolutely have to follow to the letter. And of course with ataxia patients, it's about balancing the benefits of exercise in terms of your ataxia with protecting yourself from potential risk of COVID-19. So for some people with ataxia, being able to get out and go for a walk is very, very important. If you can't do it safely and reliably avoid face-to-face contact with other people, then unfortunately, the advice is to stay at home for the next 12 weeks. So I think that's, it's about weighing up, what the risks are for you personally. I can't say, where this person lives, whether that's a very high risk area. But, if you can find a way of doing exercise at home, that would be preferable. But if you can safely leave the house at 6 o'clock in the morning and go for a walk and not run into another living soul, then you're not exposing yourself to any risk. So it's about trying to do it as safely as possible.
Thank you, Suzanne. Just having a look in the chat to see if there's any questions. We've just got a few minutes to cover a couple more questions. So someone has commented that the advice letters are only relevant to England, and what was that? Yeah, for advice letters are relevant for England only, and that Scotland, Wales and Northern Ireland have different versions. I don't know if that's something we know anything about that anyone could comment on.
I think that was to do with the letters being sent. I think that comment was put quite early on in the talk.
Yeah. Okay, so the
a bit later is what the comment was. But I think the advice is the same for all countries in terms of shielding and being vulnerable. It's just maybe the timing of getting the letters at different times.
Okay, so the letters may have gone out later in Wales and Scotland and Northern Ireland. Okay, thank you. Okay, so question here. So at the end of the shielding period, say that's 12 weeks, what do you think will happen for extremely vulnerable person dependent on a working husband for care? Probably quite a difficult one to answer.
So at the moment, the people who need to follow that very, very stringent advice, at the end of the 12-week period, if, for example, your partner needed to return to work, then you would have to continue to try to follow that distancing advice as closely as possible. So for some people that might mean isolating in a room. The shielding advice is actually extremely limiting, that you shouldn't be sharing a bathroom, you shouldn't be sharing a bed. So at the end of those 12 weeks, if your partner isn't required to shield, but obviously is expected to try to maintain social distancing as much as we all are, and to be especially careful with hand washing, etc. at home. But the advice is really to limit that contact within the home as much as possible as well. So using separate linen, making sure you're not preparing meals at the same time, handling each other's cutlery, plates, etc. So that advice would need to continue. Obviously, if somebody then goes back to work, it doesn't really change. The advice is still for you to be extremely careful with contact within the home. At the moment, while everybody is at home, you can probably view that in a slightly more lax way, that your partner is not exposed to as much if they were to return to work and start taking the train or the tube or whatever. In that scenario, you probably would need to move into the extremely detailed bit of that letter saying, to isolate within the home and avoid all face-to-face contact, really. Obviously, we don't know what's going to happen in the next 12 weeks. So I think the advice really would be just to keep an eye on that shielding bit of the government website, because that information may change again. So I think it's kind of difficult to predict what is going to happen, but at the moment, that advice is very, very limiting, and as much as possible, you need to try to follow it.
Yeah, I think that's really important for everything that we've said, really, is that the advice is changing, and to have a look, all the links are on our website, so to keep up to date with what's being said. So I think that's all the questions.
For the changing, I think it would be good if you feel that this is useful to you. We are happy to carry on this series of webinars and to have always this Q&A, because if you find it useful, then we can carry on, and we are going to be updating ourselves and yourself, and so you have the opportunity to share your doubts and to ask more questions, to dig down some rules, because sometimes it is confusing. It is confusing, and so perhaps just discussing it will make a difference. So we are here for you. So please email us and get in contact with us, either with my secretary, Suzanne, myself, and we will be able as well to reply on your specific questions. You know, as the time goes by, obviously the situation is progressing and changing. So if you have some doubts, give us a shout and give us a call or email us.
Thank you, Paola, and the same as well with contacting Ataxia UK. We're here to help if anyone has any questions. And just want to say a really, really big thank you to Paola and Suzanne, because this has just been, it's been a lot of work from them and it's so helpful to us. So I really want to thank both of you for your input there, and also to Harriet Bonney, who's been really, really helpful with the advice on the website as well. So thank you. The recording hopefully will be up on the website and the slides as well. So look out for that. And thanks everybody for coming.
Thank you.
All right, thank you.
Thanks everyone. See you all soon.
Thank you.
Bye.
Bye.
Bye-bye. Bye.